Hi, this is Digital Femme and welcome to my channel. So, you know what? In this video, the topic is going to be COVID-19. I wasn't going to do a video on COVID-19, but a few things happened to me earlier this week. Oh, actually, no, today is Monday. Anyway, a few things happened to me on the weekend, and by happened meaning I got into a few discussions with a number of people, and I just wanted to share their thoughts and what you guys had to say about it. We know that this topic is very divided. There are people that are definitely afraid of it, so they don't even go out of their home actually, and it's affecting them psychologically, emotionally, and that whole bit. Then there are people who absolutely do not believe that it's a thing and that it's fake. So they go out their merry way, wanton of all harm, or even the fact that they perhaps need to protect themselves or other people. And both these extreme thinking is really affecting, I guess, people in like groups of families. There are a number of families who have opposing opinions about this whole COVID-19, and they're actually almost in a family dispute. Not my family, I'm just saying. So if you want to hear what I have to say or what other people have to say, just go ahead and continue watching. Hi, I'm glad you stayed. So can you believe it? It's been how many months now since this whole COVID-19 has taken over our lives? When was it? I think certain countries started to have a lockdown with March, first week of March, or even prior to March, and they slowly rolled it out. So I live in Canada, and I know that the lockdown happened around March 16, thereabouts. And, everybody complied. Well, some people didn't, but most did, because they thought that it was just going to be for 2 weeks until numbers have shown or cases have shown a drop, or just to make sure that numbers weren't growing or cases weren't growing. Now, in terms of numbers of COVID-19, what numbers? There are numbers of cases of COVID-19, but what cases? Sometimes the media doesn't really portray it correctly, because we don't even know if cases could actually mean deaths, or cases could actually mean that they have the COVID-19 disease, or cases could mean they test positive for it, right? It all depends on the context of the, like the information. That's what I've heard, and that's what a lot of people are battling. It's funny, the reason why I wanted to talk about COVID was because I saw a tweet from Grant Cardone, and he said that Elon Musk just tweeted something like they need to retest the people that have tested positive because of so many false positives. And I'm thinking, yes, that is a possibility. Now, I haven't kept up with any of the numbers of COVID, although I'm a data freak. This is one thing that I do not keep up on. Why? Because I chose not to. And here's something. I chose not to because personally for me, there is nothing I can do to make it better other than just keep healthy for myself, and to know that if I do go out without a mask, I'm sorry to say, I do go out without a mask. I'm one of those. However, I do maintain social distancing. And plus, I am in a city in Canada that isn't very heavily populated. And when I do go out, if I do go out, it's not very busy. I work remotely from home with a marketing agency, so I'm pretty much at home all the time. If I do step out, I'm lucky if I step out once a week. I'm not kidding. And if maybe if I do, it would be once every other weekend to get groceries at Costco, or I will just run out to the mall. And by run, I don't run. I walk fast to the mall, which is 4 minutes away, get what I need to get, do safe social distancing, and then come back home. So please, for those of you that are going to crucify me for not wearing a mask. I'm not going to apologize. It is my right until, further notice. So you need to know that I was a nurse for 11 years in Texas. And, who cares, right? Yeah. But I also was infection control and employee health nurse for about 2 years. So I do understand the whole virus thing and the mutation and all the vaccination things and immunity buildup and all that. This is not a video that's going to tell you about the medical or the science of COVID-19. Just simple. All I know is it's really dividing people. And do I have my own opinion about COVID-19? I do, but this is not the video that I'm going to share it with. All I know is that, I don't know. That was a filler. It's just crazy. So I happened to go on the World Health Organization site, www.who.int. And it's funny, but they have a list of facts like Mythbusters. So if you go on their site, there's a link to go that says coronavirus, COVID-19, advice for the public, and then one of the sub headlines is Mythbusters. So I'm reading all these myth-busting things, and it's interesting. Stuff like, number one, fact. They don't number the facts. It would be nice for them to number the facts so we could reference them easily. But one of the top fact is studies show hydroxychloroquine. Was I really a nurse? Yes, I was. Does not have clinical benefits in treating COVID-19. And then they also go down to say that there is no licensed medication to treat COVID-19. There are clinical trials, but there is no licensed medication. Licensed meaning approved by the FDA, and that's final. After all these clinical trials, they're clear that this is the one, and their tests show, or the clinical trials show, so there has not been one. It's funny, there's also one that says, fact, the likelihood of shoes spreading COVID-19 is very low. Yeah, I don't know how that came about, how shoes spread COVID-19. Maybe it's because of people, I don't know, sharing shoes or crawling around and playing on the floors close to shoes. I found that was ridiculous. Another one is something about garlic does not cure COVID-19. Well, yeah, of course. Okay, maybe I'm reading it wrong. It's not cure, but prevent. Garlic does not prevent COVID-19. Yeah, okay. Then they're saying garlic is good to increase your immune system and stuff like that. But no, I guess the point is, if you keep taking garlic, you will not be, it's not going to give you immunity to COVID-19. Here's something interesting. Thermal scanners cannot detect COVID-19. So apparently airports or certain, I don't know, venues or entrance venues are instilling these thermal scanners to test if people are coming across with temperatures. So they're saying, yeah, no, that doesn't do that. I'm not going to go over each fact. You can go to the WHO site and look at it yourself, but I just thought I'd mention it because it was really, I don't know, really interesting. Now, in terms of false positive, yeah, I'm not there. I'm not there to do the testing, and I'm not even there to, read the results. So there's so many things that go along with the false positive. There's so many variables involved, and it depends on the testing. Yes, there's a standard procedure on the tests. It's the accountability of the person who is administering the test, how the test is, I guess, stored from the time it's collected from, let's call it a patient. They're not patients, but let's call it a person, to the travel time to where it gets to where it's tested, and how long the results and all that stuff. So I'm not there, so I can't speak to it. Are all the conditions the same in terms of environmental temperature? Is it the same equipment? There's also, are the equipments calibrated? Or I don't know. I don't know what kind of tests. Like I said, I have not really looked into the science of COVID, other than what I know about vaccines and viruses and whatnot. And why? I don't know if I clearly explained it in the beginning of the video. I guess I didn't. I choose not to. And the reason why I choose not to is because, oh yes, I did, because I just wanted to focus on just keeping my immunity up and being healthy. And I'd rather not put that in my vibration. So you need to know I'm not woo-woo. There's nothing woo-woo about me. But I do believe that everything has a frequency and a vibration, and I do believe that there is mind over matter. And there might be a few of you that's going to lambast me in the comments saying, oh, you can't just meditate an illness away, or you just can't meditate increasing your immunity. Yes, I can. And there are a number of cases, not just a number, thousands and thousands of cases where people, I wouldn't say meditated, but it's like really the mind over matter thing. And that is a topic that is very, very extensive. And there's a lot of YouTube channels that talk about that whole mind over matter, or imagining or envisioning, your body healing, your health. And this is not the channel, but I will mention that there are channels out there, and there are thousands and thousands of cases where people have literally healed themselves just from their attitude and their mindset. It goes a long, long way. And I'm a very firm believer of that, because a number of things have happened to me in my life that have proven to me that it works. And the consistency of it, in terms of related to health, related to things I wanted in my life, and just in general. That's all I'm gonna say for now. What I would like to know is, we're already, just as summer was beginning, and then midsummer things started to loosen up, and finally a lot of countries or cities or regions have went through from stage 1, stage 2 of opening up, like the city again, or social stuff again, to stage 3, and everything was fine. We can go to restaurants, except restaurants now could only accommodate fewer numbers. You could tell that when you go to a restaurant, there are literally tables that are empty because for the social distancing. We could still go to bars. I have not gone to any clubs or anything. I haven't gone to a club in like literally over a decade. But I know that they were open, and I can't really speak for that. And masks were not mandatory, obviously. Then slowly towards the end of the summer, in some regions, certain corporations started, saying you need to have a mask prior to entering. One of them was Walmart. There was in July, August, I could go to Walmart and wearing a mask was like voluntary. Then I went again, I guess beginning of September. I'm not don't quote me, but it was around end of August, beginning of September. Then all of a sudden, or was it September? Yeah, mid-September. All of a sudden, I went back to Walmart, and then it was mandatory to wear a mask. Another corporation is Starbucks. I would visit Starbucks, and a mask was only voluntary. Yes, the employees had to wear masks, but the patrons not. And then I went to the same Starbucks a few weeks ago, and you had to wear a mask. So here's the inconsistency with that. There is plexiglass everywhere. I go to the same Starbucks with plexiglass, and I order, and then I'm said, ma'am, you need to wear a mask. And I'm like, what? Now, I did have a mask with me. I bought a pack of 2 just in case. So I said, really? I said, I was here last week and I didn't have to wear a mask. And she goes, yes, ma'am, but the rules have changed, now it's mandatory. Then she pointed to a new sign. And I'm like, okay. And I was going to reach down, and I said, but she volunteered. She goes, do you have one? I have one for you. And I said, okay. So this is so funny. The employee at Starbucks hands me a mask with her fingers, with her hands. So right there, that's a red flag, because you all know, like I know, has a number one prevention of disease is hand washing. Like literally in infection control, the first rule of infection control is hand washing for like 10 seconds, or until you finish singing the happy birthday song. I'm not kidding you, or more than 10 seconds. And it's funny, but the employee handed me this mask that wasn't even in a package, but with her bare hands. Now, she could have coughed. She was wearing a mask as well, but still, right? That was just like ridiculous. The mask should have been in a package. So I just took it and I put it on, whatever, because I wanted my Starbucks. I didn't want to make a scene. However, there was a group of people in their Starbucks communal table with their laptops with no masks. And then as I received my coffee, I said to them, "Excuse me, it doesn't make sense. I'm only here behind a plexiglass, clearly social distanced, and I'm required to wear a mask, and yet there are a group of 5 people in that table that are talking and not wearing a mask." And then the girl said, "Yes, ma'am, because they're eating." And I'm like, okay, that fucking, excuse my language, doesn't make sense. So I wear a mask. I'm only going to be in Starbucks the length of time that it takes for me to order and for them to prepare my drink and for me to get the hell out of there. And yet you have people, with the laptops, because I'm one of them, who will stay in a coffee venue to work. And she did say, yes, they were eating, but you know what? I literally walked, I walked about 4 feet to them, and I looked around, and yes, they had like a napkin, but literally there was no more food. So then I went back to the girl and I said, they may have been eating, but I'm pretty sure they've stopped. And how many hours or time have they been there? Because it looks like they're doing a project. And when you're there with a laptop with a group of people, you're not just there for the duration of your finished eating. And then she couldn't say anything. And I just went, I'm just saying it doesn't make sense. So, it's like there's absolutely no consistency. They enforce these rules, and yet there is no consistency. And it logically does not make sense. And there's no common sense to it. It's crazy. And this is just one small example of how it totally doesn't make sense. Like, you know what? I'll just stop. I don't mean to rant, but that was a rant, wasn't it? Well, how are you guys dealing with it? And what side of the COVID spectrum, of the reality of COVID-19 spectrum are you? Are you, oh my God, I never leave my house and it's making me sick and blah, 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 and I'm scared and I don't want to die? Because there are people in my apartment building that they are like that, and it's, whatever, it's them. Then there are people that are just don't give a flying F, and they're like walking around and not social distancing and all that, this arrogance that they have. Or where are you in that spectrum? I would love to know. Please put in your comments below. This channel is not about judging, although I may be a hypocrite. I'm sorry. It may be because some of the sentences I say could be perceived as judgmental. I don't mean it that way, but if it is what it is. But just to let you know, this channel is not about judging. It's really about sharing and having, I guess, a one-sided dialogue, because I'm just the one talking, unless it's a live, stream or on Zoom and we can all have a chat. But I really would love to hear your comments below. And I know what channel would not talk about COVID. This is not to gain followers or views, but I just, it was the weekend that I had where I was an observer of these different conversations among family members, social distancing, of course, and, wearing masks or whatnot, and on Zoom as well. And I was just listening to what people said, and especially on Twitter, like, Grant Cardone posted that tweet about, Elon Musk tweeted for those who had tested positive to retake the test because there are a number of false positive cases. And I read the comments and replies from Grant Cardone's tweet, and honestly, it was like 50-50. People were saying, we're questioning, I guess, the nature of the data and the steps of collecting the specimens, whatever. And then other people were saying that we're kind of like putting Grant Cardone down for even tweeting that, or for Elon Musk for even thinking that. So, that's what's great about the human race. Human Homo sapiens. What was it? Homo is, what is it? Sapien means wise, like wise ones. Okay, I forgot I never really took Latin, but I know Homo sapien is, means something like something wise ones, because we're like rational. We have a brain and we can rationalize things. Sometimes I think being able to rationalize things isn't exactly a gift, more than a hindrance, because honestly, you can rationalize yourself out of anything or into anything, especially with opinions and egos and meh. Well, that's all for now. If you're new to this channel, just want to let you know that this is my 122nd video or 23rd video, although I thought that it was my 124th and 125th. Anyway, this is my I'd like to say 22nd video. It could be the 23rd, 122nd or 123rd video in the 1,000 day challenge. And what that is choosing to do one thing for 1 hour a day for 1,000 days straight. And I've chosen to do a video a day on this YouTube channel just to jumpstart it, because I pretty much left it for dead around 2012 or 2010. And this channel did start in 2008. Anyway, I'm going to go, but I do want to say, do consider subscribing to this channel. Why? Because I always say towards the end of the video that if I do not have one or two videos in my video library that speaks to you or resonate with you, I will have one that will in the near future. So consider subscribing, hit that notification bell so you know what, you don't even have to hit the notification bell, because I will I do upload a video every day. I just want to thank you for coming onto this channel, for staying this long in this video, and wherever you are in this world, have a great day and a great evening. Okay, see you tomorrow. Bye-bye. And stay safe and healthy.